It's Merry Monarch Week, and we wanted to talk about some of the health challenges facing Native Hawaiians. Dr. Leimomi Kanagusuku is a Waianae native and Kamehameha School's graduate Imua, who is now a family medicine physician at Pali Momi Medical Center. Doctor, what are some of the major health concerns facing Native Hawaiians?
Much like other Native populations, Native Hawaiians have higher rates of chronic disease than other groups. So multiple studies have found that we have 2 to 3 times more likely to have diabetes, coronary artery disease, congestive heart failure, stroke, and multiple types of cancer. In addition, we are likely to be afflicted with these types of chronic diseases way earlier, even a decade earlier than other populations. And in some cases, we are also more likely to die from those types of specific causes when compared to the general population.
Are there non-medical factors that also disproportionately affect Native Hawaiians?
I'm glad you bring up that great point. So health is an extremely complex structure, and as a family medicine physician, I try to think of patients as a whole, so in setting of multiple factors. And so that includes their physical environment. Do people have sidewalks to walk on? Do they have access to healthy foods like fruits and vegetables? As far as social support, do they feel safe in their communities, and access to care? Are they able to get a doctor when they need one? So we're trying to currently tackle some of those areas by opening more clinics in communities, provide telehealth options, and just increase access to care in general.
What are some lifestyle changes we can do to prevent chronic diseases?
I'm glad you phrased it that way, lifestyle changes, because that's exactly what the goal is, to incorporate things into our daily life and things that we enjoy. So today's way of life is just so busy. We're always on the move. We're too busy or too tired to do anything in addition to that hectic schedule. So I usually recommend to keep it simple. Just start by going for a 15-minute walk on the weekend with your family, and then you can gradually increase to 30 minutes 3 times a week, and then eventually more. When it comes to family meals, I recommend using the My Plate model at least 80% of the time, where half the plate are fruits and vegetables, quarter are protein, and quarter are whole grains. And of course, there are times where you just have to go to that graduation party or go to the baby luau or, celebrate Merry Monarch. And you don't necessarily need to follow that model, but that's exactly why it's called a healthy habit.
Mahalo, doctor, and thank you for making this a healthier Hawaii.